Cognitive behavioral therapy is quite different from most other types of psychotherapies because sessions have a solid structure instead of clients talking about whatever comes to their mind. At the beginning of the therapy, the client meets the therapist to describe specific problems and to set goals they want to work towards. There could be all kinds of problems such as insomnia, unfulfilling social relations, problems at work, troubles with children, or being in an unhappy relationship or marriage. These problems and goals then become the basis for planning the content of sessions and discussing how to deal with them. At the beginning of a session, the client and therapist will decide on the main topics they want to work on this week, and they will also talk about the progress made since the last week. At the end of the session, they will plan another assignment to do outside these sessions. Therapy can vary significantly according to individual patients, their difficulties, as well as their education, intellectual level, gender, and cultural background. Treatments might also vary depending on patients' goals, their ability to commit themselves to the process, their motivation to change, their previous experience with therapy, among other factors. Also, the structure of therapy sessions is quite similar for the various disorders, but interventions can be quite different, considerable from patient to patient. The therapist has to review the self-help activities, homework, and also how much patients are engaged in since the previous session. After that, the therapist collects data about the problem and also conceptualize patients' difficulties, meaning asking for their specific thoughts, emotions, and behaviors associated with the problem. And they work together and plan a strategy. In most cases, the strategy includes straightforward problem solving, evaluating patients' negative thinking associated with the problem, as well as behavior change. Doing homework is very important. Working on homework assignments between sessions in this way is a vital part of the process. What this may involve will vary. For example, at the start of the therapy, the therapist might ask the client to keep a diary of any situation that provoke feelings of anxiety or depression, so that they can examine thoughts surrounding this incident. Later on in the therapy, another assignment might consist of exercises to cope with problems and situations of a particular kind. Also, we should talk about the importance of structure. The reason for having this structure is that it helps to use the therapeutic time most efficiently. It also makes sure that important information isn't missed out. For instance, the results of the homework. And also that both therapist and client think about new assignments that will naturally follow on from the session. The therapist has to take an active part in structuring the sessions to begin with. As the progress is made and clients grasp the principles they find helpful, they take more and more responsibility for the content of sessions. So by the end, the client feels empowered to continue working independently. Cognitive behavioral therapy is usually a one-to-one therapy, but it's also well suited to working in groups or families, particularly at the beginning of the therapy. Many people find great benefit from sharing their difficulties with others who may have similar problems, even though this may seem a little bit scary at first. The group can also be a source of especially valuable support and advice, because it comes from people with personal experience with this kind of problem. Also, by seeing several people at once, service providers can offer help to more people at the same time, so people can get help sooner. Another question we must ask ourselves is how else CBT differs from other therapies. Well, cognitive behavioral therapy also differs from other therapies in the nature of the relationship that the therapist will try to establish. Some therapists encourage the client to be dependent on the therapist as part of the treatment process. The client can then easily come to see the therapist as all-knowing and all-powerful, which will not benefit the process and the healing. And this is why in CBT the relationship is quite different, because there is much more collaboration and much more feeling of working together between the therapist and the client.